It's that time. It's that time. And I'm having a hard time here again today. Nothing new there. On the 28th of February, I went to see the doctor, and he, prescribed me all of this nonsense, suggesting that the issue I'm having with the choking, gagging phlegm that makes me sick every day was GERD. During the consultation, I think I made it clear that I did not think it was GERD, because funnily enough, shortly before I'd actually gone to see the doctor in desperation, I had looked up GERD and had very quickly discounted it as any possible likelihood of what's causing my difficulties here. And anyway, he's the doctor, so I have to give it the 2 weeks. He said that he wrote that down for me on a post-it note, so I was able to remember. He suggested that I should have an online consultation in 2 weeks. Well, that's now. That was yesterday. I went on their website, and I could not, for the life of me, see anywhere to have an online consultation. I couldn't see any means to do so. You can't even book regular slots to see a doctor online anymore. They've done away with that. Really all that remains is that you ring up at 8 o'clock in the morning. So I was a bit stumped. So what I did, like an idiot, I crafted an email. I won't show it here because I haven't edited it out. Bits that should probably be confidential. But I crafted an email, sort of explaining, look, you suggested I take this, blah blah blah. I've had no benefit from that whatsoever. Things are just getting worse and worse and worse. I also requested that he actually look at the 2 videos I made with a desperate plea that he should watch at least the first 3 minutes. I made 2 ill health videos on the 3rd of March. And the first video, the first 3 minutes of the first video, I think are pertinent, because they show the desperate mess I'm in with this coughing and spitting and coughing up goodness knows what. Anyway, so I crafted this email and I mailed it yesterday. I've just had the reply. The reply is basically there is no reply. You don't get replies to emails. And they've got the gall to title this effectively telling me to fuck off. They've got the gall to say, to improve patient safety, patients must complete an online form which could be accessed via our website. Yeah, well, I went there and it was clearly not appropriate for a review of a consultation I had 2 weeks ago. I mean, there's nothing like that. Basically, you have to input a load of stuff and start all over again. There's a link here. So, just round and round and round in circles, getting told to fuck off effectively. Please note, patients will not receive a reply to their email. To improve patient safety, they're taking the mick, aren't they? There is no health cover here at all anymore. I've been struggling here since December. And what am I supposed to do here? What am I supposed to do here? And what I'm going to do is show. Let me get a browser up on the screen here. Let me show you what happens if I go to the medical centre website. There, bang. Overlaid on top of the website, the normal website information, is this notice. Extreme pressure. Our capacity today has reached unsafe levels and we are having to implement drastic measures to ensure the safety and well-being, etc., etc., etc. So basically, again, it's just saying fuck off. Yeah, you're ill. You're trying to get in touch with a doctor. Fuck off. This is wrong. This is not right. This is not the way to be treating people. This is just not right. It's just not right. Is there any wonder that we are seeing excess deaths in this country higher than has ever been seen before? Is it any wonder? This is outrageous. This is just outrageous. See, on online services, the online booking facility has been disabled. So how do I get a follow-up consultation with the same doctor? How do I do it? How do I do it? Yeah, this is, yeah, it ran around in circles. This is the link that was sent back in the reply to my email saying that I'm not getting a reply. They said do this link, and basically I want to see online advice. Well, that's just the nonsense that you get on the NHS website. Yeah, that isn't like talking to a doctor, is it? I want help for a medical issue. That's me. And immediately you're presented with, you know, if you're dying, call 999, and then they won't send an ambulance. Your request will not be seen immediately. It's just ran around in circles. It's right. So again, I'm back to this. This is the only way that I'm going to be able to make any contact with the surgery here, and it's like starting from scratch. It's starting from scratch. If you're filling this in, please describe the medical problem. How do I describe this? In 300 characters, how do I describe this? How long have these symptoms been going on? Well, since December. What's that got to do with me trying to speak to the same doctor who's prescribed me all this for no good reason? How would you like us to help? Well, actually, act like a flipping bunch of doctors. That'd be good. Actually, act like a health service. Actually, maybe treat your patients like human flipping beings. Is there anything you are particularly worried about? The major concern I've got in my mind right now, frankly, is, you know, how can I commit suicide? Absolutely make sure that it's 100% reliable. How can I make sure that it's relatively painless? And how can I also take the bear with me? I'm sick of this. I'm sick of it. Right, let's let's do the whole bit. This is what happens if you try dialing the surgery.
Welcome to Compass House Medical Centres. If you are calling due to a life-threatening condition, please hang up now and dial 999 to contact the ambulance service.
Please be aware our capacity today has reached unsafe levels and we're having to implement drastic measures to ensure the safety and well-being of our patients and staff. We need to ensure our severely unwell and vulnerable patients with the most significant needs can access the support they need from us in a timely manner, and so we are unable to accept any more calls for appointments today. In the meantime, we recommend visiting our website, where we have listed some alternative services that may be able to help with your query. Alternatively, we recommend trying us again tomorrow. Thank you.
Our patient care advisors are here to help with your call. They will ask you a couple of short questions to ensure you are directed to the most appropriate service. All your information is treated in the utmost confidence. Please be aware calls are recorded for training and monitoring purposes. For appointments, please press option 1. For prescription ordering information only, please press 2. For the results line available between 2 p.m. and 5 p.m, please press option 3. For all other information, please hold. Thank you. Please hold the line while your call is transferred to the operator.
I'm sorry, say that again.
Can I take your date of birth, please? And the name?
Terry Jones.
And the first line of the address? How can I help?
2 weeks ago, on 28th of February, I saw a doctor, and he said that I should get back in touch with him in 2 weeks' time to have an online consultation. I don't know how to do that. I've been round and round and round in circles on the website, and it's just, how can I ensure that I actually just get to speak to Dr. to tell him that what he prescribes has had no beneficial effect and my condition has worsened?
Okay, if you go onto the Compass Health Medical Centre website...
Yeah, it says extreme pressure, our capacity today has reached unsafe levels.
Yeah, just exit that.
Yeah.
Just cross on that. And then you see the blue box that says contact us online?
Yeah.
Click on that.
Click
I want help for a medical issue.
This is online services you're talking about, is it?
Yeah.
Yeah, I've been round and round. But that puts me through to a form which is starting from scratch, asking me, what's the problem? How long has it been going on? I need to talk to specifically Dr.
Yeah, so you just need to fill out the form and just say that it's to speak with who's our assistant nurse practitioner. So you need to just fill it out, and then it will come straight through to us, and we'll be able to pre-book an appointment with for you.
Okay. I'm sorry. How does that work? Pre-book an appointment. So you need to talk to me about when that's going to be, don't you?
So you send it to us, and we'll pre-book a phone call with for you, and we'll send you a text as to when to expect that phone call.
Right. Okay. Thank you very much for your help.
All right. Thank you. Bye.
Bye.